it's Dr. Carrie Howe with Restore Pelvic Physical Therapy, and today I want to share 4 things that every woman should know about pain during sex. As a clinician, I really enjoy working with these cases and helping women who are experiencing pain with intercourse because not only are we now helping repair them physically and returning to an activity pain-free, but we're also helping restore and reconnect these relationships that might have been lost throughout this process. Some common false narratives that we hear at Restore are some women think that maybe their partner's too large, or maybe it's all in their mind. They try to create these ideas or reasons as to why they're experiencing pain with intercourse. Painful intercourse is a really common problem for women, and it's probably one of the most vulnerable, intimate situations that I deal with when working with patients here at Restore. These women can feel hopeless or think that something's wrong with them and just not understand what's going on and be really frustrated. So if this sounds like something you've been struggling with, here are 4 things I want you to know. Number 1, sex should feel good, and at the very least, it should be pain-free. It's strange that we talk so much about what leads up to sex or what happens after sex, but we don't actually talk about sex itself. And it can and it should feel pleasurable. And this is something that pelvic physical therapy can really help with. Number 2, intimacy is important. It's just something that we have to admit that physical intimacy is a big part of relationships. It's what makes them meaningful at a different level. And for women who are dealing with pain during intercourse, it can decrease that desire and that arousal to want to participate. And as women, we want to feel sexy and we want to please our partner. And if it's something that we are struggling with, it can feel really defeating. It's not just hurting these women physically, it can have a really devastating effect emotionally if you're unable to connect with your partner at such an intimate level. So this is certainly intimacy that we cannot avoid. Number 3, there is a solution. Now, there can be a lot of different reasons why somebody is experiencing pain with intercourse, but I think one of the most often looked components is that there is a musculoskeletal involvement with sexual intercourse. I was a year into physical therapy school before I even realized that there were muscles inside of my pelvis, and these muscles play a role in sexual intercourse. They kind of wrap around the vaginal opening, and you can think about these muscles need to lengthen and relax to allow vaginal penetration to be comfortable and to be pleasurable. So the disclaimer is that we pelvic physical therapists are not sex therapists, but there are certainly things that we can do in pelvic physical therapy to help make this a more pleasurable experience between techniques and strategies, positions, and exercises. There are a lot of things that we can work with. And the last one, number 4, don't suffer in silence. This is not something that you should just deal with, and it's not something that you should have to go through. I totally get that this can be a really embarrassing and vulnerable conversation to have with your partner or your girlfriends or even a healthcare provider, but the fact of the matter is that if you're suffering with pain during intercourse, you are not alone. Again, it is a very common issue, and we need to start being advocates for ourselves as women that this is not acceptable, that there is help, and this is something that we can improve relationships with. There are lots of treatment solutions that we can do here at Restore to hopefully help you return to a more pleasurable experience. So if you have been experiencing pain during intercourse, or maybe you have stopped and avoided sex altogether because of this, please reach out and get help.